Breast cancer is no longer the death sentence it used to be. Learn the latest on prevention and research that could save your life. Next on Living Smart. Hello, I'm Patricia Gras. Welcome to Living Smart. This is a new series about getting the most out of life. Today's guest, breast cancer specialist Dr. Mirtha Casimir, shares her wisdom on prevention, new treatments, and what you need to know about the disease. Have pen and paper ready. At the end of the show, we'll give you some resources.
You lie down.
Okay.
And we'll have a look at how you're doing. How was the last chemo?
Good.
Dr. Jenny Chang at Baylor College of Medicine's Breast Center is on a mission. She wants customized specific treatments for her breast cancer patients. So she conducts genomic research, the study of all genes in a person. In this case, she's dealing with breast cancer genes. With this biopsy, she hopes to find the genetic makeup of her patient's tumor.
Just a little sting here. Did really well. The moment we basically treat everybody in exactly the same manner. In the future, we hope that this kind of research, the genomic research in profiling individual tumors, will be able to individualize treatment for women so that they get exactly the right treatment that they need and not just a off-the-peg, one-size-fits-all treatment.
Dr. Mirtha Casimir began referring her high-risk patients to Dr. Chang about 2 years ago.
There are some populations of patients that require more specialized and what we call cutting-edge technology. And one of them would be identifying high-risk populations where we can genetically test them and do appropriate genetic counseling.
Dr. Casimir identified about 50 families with familiar breast cancer in her practice. Only about 20% of all breast cancers are genetic. Rosie had this type of cancer, and Dr. Casimir felt she could benefit from the genetic research at Baylor.
Morning.
How are you today?
I'm doing great. My youngest sister, which was 28, she was diagnosed in 89. Then my mother was diagnosed at 55 in the same year. Then I, in 1996, was diagnosed. Then once I had started my treatments and had my surgery, my older sister came down. My mother's two sisters had breast cancer also. And one sister has 2 girls and a son, which she had breast cancer, and her 2 daughters. But those both daughters have passed away related to breast cancer.
Rosie not only had a mastectomy followed by chemotherapy and radiation, she also had a hysterectomy due to ovarian cancer risk. After all the devastation cancer had caused her family, she felt she needed genetic testing.
I think it gives me a sense of empowerment. And one reason why I say that is because the experiences that I've had since I've been diagnosed, I don't want anybody else to get it. And that's the part that really hurts me the most. Mothers are losing their daughters. You know, my 2 aunts, they've lost their daughters because of this, you know. And this is a generation, you know, as generation goes, we don't want to have to live, you know, have the fear of someone else.
Both doctors struggle to prevent breast cancers in these families using risk reduction protocols.
Which is very important that those patients enter into a protocol because we do not have the answers. And being able to, many of these are young women who do not want to undergo a bilateral mastectomy, who still want to have children. So, but at the same time, they want to reduce their risk. So there are a number of protocols they can be entered to. We trying to offer patients in the community treatments that may not be available in a community setting and be able to say to these patients, we believe that these treatments will work better than others based on this technology. The genetic counselor is
Dr. Casimir, thank you so much for joining us in Living Smart.
My pleasure. Thank you for inviting me.
It's very confusing. We get so much information about breast cancer. For example, certain size bra can cause cancer, breast cancer. Too many carbohydrates can cause breast cancer. Obesity can cause breast cancer. It's very confusing. Do we know actually what causes breast cancer?
Well, Patricia, breast cancer, according to the American Cancer Society, is a disease without borders. But we know that there are regions in the world where there is a higher concentration, and that appears to be in the developed countries, which points more towards environmental factors, reproductive factors, diet factors. We know that there are certain things that give higher risk to a patient to develop breast cancer, those being family history, menarche at early age, late menopause, lack of fertility, and maybe the use of hormonal replacement.
What about prevention? We also hear different things about prevention, like omega-3, eat your berries, soy, eat soy. What about those things that they say this can prevent you from getting breast cancer?
Well, there is not clear evidence that any single factor will prevent breast cancer. We think that breast cancer is a group of diseases with different manifestations, with different biology. So we cannot at this point just say this
you
will
can do
prevent
this
you.
and you'll be fine.
There is not a one-size-fits-all.
So the most important thing we hear is prevention. And one of the things that you teach is self-breast examinations and mammographies. Tell me about that.
Well, the American Cancer Society has changed their recommendations for prevention and early detection. The recommendations, the current recommendations now, is that women start breast self-examination at the age of 20, but mostly as to raise consciousness, to raise awareness that you may have changes. We know that that has not contributed to earlier detection or has not changed survival. We do know, however, that the use of mammograms has really changed the way we diagnose this disease, and we find now very, very early tumors that 10 years ago we would have not even dreamed of. So the current recommendations for women with an average risk is breast self-examination starting at the age of 20 to 40, clinical breast examination, which means an examination by a physician 3 times a year, every 3 years between the ages of 20 to 40. A mammogram starting at the age of 40 with a clinical breast examination yearly thereafter.
We hear that there's some controversy, though, about the safety of mammograms.
Well, the risk of developing another cancer because of the use of mammograms is minimal. I usually advise women who are at a higher risk, with a risk of 15-20%, who require frequent mammograms every 6 months and required other technologies such as an MRI or an ultrasound to be able to detect those cancers, that they may be at an increased risk. But then you need to put all that in the context of their lifetime risk.
Right, right. When should women begin to consider a family history as a risk factor?
Every time you have another relative with breast cancer. And you should consider that very seriously is you have a mother and a sister, when you have more than one woman in your family affected with this disease.
Can someone estimate their own risk? Let's say someone like me who doesn't have breast cancer in the family, can I estimate my own risk or not?
No, but your gynecologist probably can. And there are certain elements that he would take into account, such as the age you started your menarche or your periods, and whether you have children, at what age did you have children, at what age did you enter menopause. How many relatives do you have affected with this disease? There are more sophisticated models that can give you a prediction And then we use some of these models to see if you are a candidate for genetic counseling.
Okay. Estrogen replacement therapy. We hear different things about that, and yet hormones do play a big role in breast cancer, don't they? What do we need to know about hormones and breast cancer?
Well, breast cancer is a hormonal event, and it is related to a reproductive life of a woman. And the current recommendations is not to use hormonal replacement after menopause.
Really? So that's what they advise. Even if it's, what about if it's progesterone that you need as opposed to estrogen, which seems to be more
I just don't think there is clear evidence that really will help you in terms of cardiovascular risk decrease or improvement in any other aspect of your life, even cognitive functions that we as women used to think that if we have estrogens, we could prevent heart attacks.
And that's not the case.
Correct.
Birth control pills, do they have an impact at all on breast cancer?
It's still somewhat controversial.
We don't know yet,
we don't know yet. And the amount of time that women use birth control pills is sometimes less than the amount of times that women use hormones as a replacement.
How open are you? I'm sure that you've been doing this for almost 30 years, that you have women coming to you and saying, I want to use holistic medicine, I want to use complementary medicine. How open are you to that, and how do you deal with that?
Well, when I was young and I was smart, I used to say absolutely no. As I'm getting slightly wiser, I believe that these women are a human being with a soul, with emotions, with opinions, with intelligence, and they need more than chemotherapy. They need more than radiation to overcome that. Many times it's just fears of the treatments that they are going to take that lead them to consider alternatives. So I'm fairly open to listen and to see how we can incorporate that into what we consider a cutting-edge technology.
Have you had some patients that come with certain things that seem to work better than others, like acupuncture or a massage or different herbs or whatever they're coming with?
Well, no, but I have patients who have metastatic breast cancer that we have not been able to control the pain any other way by acupuncture, while others are able to just take regular narcotics.
Right, so it depends on the person.
So
what about intuition, female intuition? Should a woman be listening to her intuition? Let's say she feels there's something wrong with her breast, she's not getting any kind of response from the doctor. How do you respond to people that say, well, I had this and nobody was listening to me?
Well, I think that if you feel that you have a lump and you are so unfortunate to find a doctor that will not listen, even if you are 25 years old, you should probably look for a physician that would listen to you and order a mammogram, order an ultrasound, or even a biopsy, even if you are 25, 30 years old. So it is important that you do not discard a lump as, well, I'm too young and my doctor said that I shouldn't worry. I have patients as young as 25 with breast cancer. So you really should pursue your health needs, absolutely.
So be aggressive, and when you have questions,
correct.
Involved.
Be involved. Be a partner.
Okay, with your doctor. If you have a strong family history of breast cancer, how do you as a doctor advise a patient, maybe you need to have your breast removed? Maybe that's a good idea. Maybe you need to have a mastectomy.
Well, Patricia, that has changed somewhat, and when we have a patient with a very strong family history, we definitely offer them genetic counseling, and then, of course, we do some genetic testing. Should the patient be positive and be a gene carrier, we need to take into consideration the wishes of the patient to have children, and we advise them as to what can we do to be able to find these tumors very early, which in some cases involve the use of frequent mammograms, MRIs, ultrasound. The option of a bilateral mastectomy is always an option that we discuss.
Do you remember in your practice, like I said, you've been doing this for almost 30 years, some miracle stories, even that surprised you?
Yes, all the time. And yes.
What do you think it is? Is it someone's desire to fight, or what is it?
It's a combination of everything, but if I ask my scientific colleagues, they will tell me they have exquisitely sensitive cancers to chemotherapy. And, I think it's a combination of everything. We still see patients that do remarkably well. On the other side, I can erase from my memory the young ones that I lost. It's helplessness at that time because the drugs were not available. The technology was not so advanced.
Right. I mean, and that was my next question. In all the years that you've been working as an oncologist, what do you think the major breakthrough was, and how long ago was it when you started noticing, yes, this is finally working, now this is going to become a chronic disease as opposed to a killer disease?
Well, I think the breakthrough is coming in the form of early detections. When we are able to find a woman whose cancer is 0.5 centimeter, rather than coming to see a woman whose cancer is 3 and 4 and 5 centimeters with a spread into the axilla, then we have a chance. Then you have a chance for cure. In terms of other breakthrough, supportive care, where people can now drive themselves to take treatments. Nausea is most of the time no longer a problem. We have enough medications to support them to treatments. The rate of infections have decreased. And we are seeing more and more smart drugs that are targeted to specific areas of these patients' cancers. Mm-hmm. And I think that this is fascinating and this is very encouraging.
Is this the shape of things to come, do you think, in the future in breast cancer treatment, more targeted therapies?
Absolutely. I think it's in the beginnings, but I think there is a bright future for us to be able to help these women to live with cancer, where it will become like diabetes or arthritis, a totally chronic illness, and one day maybe cure.
The turning point, was it 10 years ago, 15 years ago? Do you think, when they started coming up with some good drugs? And
I think the turning point for breast cancer has been women becoming aware. Mm-hmm. Women saying, I'm going to take charge of this. This is important that we fight. It is important that we raise money for research. You know, we are the grandmothers and the mothers and the sisters and the daughters, and we matter. We are an important part of this country, of the workforce, and we have a disease that, if detected earlier, it can be cured.
Right.
So the Susan G. Komen Foundations and all these organizations that have raised so much money have helped us to start turning the corner.
What about nanotechnology? That seems to make drugs a little bit more effective. Explain how that happens.
Well, you know, Patricia, cancer cells are smart cells. They have the ability to continuously evolve and transform. So finding a silver bullet is like hitting a moving target. However, there is a constant thing that these cells need nutrients to survive. And we know that when a tumor forms, it sends a signal to the closest blood vessels, and that blood vessels protrude a vessel to feed that tumor. And then you start forming this network of vessels that
feed the cancer tumor.
The cancer. So there are drugs now being developed to block the formation of these
the connection to the blood vessels.
Correct. Yes.
I'm sorry, nanotechnology, explain what that is exactly.
Nanotechnology is, in a simple way, it's a way to deliver a drug in albumin. We know that albumin gets into the tumor in higher concentration and is highly utilized by the tumor as a nutrient. So delivering a drug through this mechanism is a way to trick the tumor to take the drug instead of the albumin.
And the albumin, what is it?
Delivery is a normal protein of our body.
Albumin is a protein,
right.
okay.
So rather than the drugs being delivered in a solvent, which many times is very toxic for other parts of our body, it's delivered on albumin. That's a very simple explanation.
Right. But it really targets the tumor more effectively.
It targets the ability to deliver a drug more effectively.
To where it needs to go. What about the theory of angiogenesis, that tumors grow by recruiting blood vessels? It has to do with the same concept, correct?
Correct.
Okay. What improvements, if any, can we expect in breast cancer treatment, do you think?
More individualized treatments, where, as we discussed, breast cancer is a group of diseases. So where one size doesn't fit all, where we can say a 33 years old woman with these cancer characteristics will require this treatment.
Right. What can you do if you've been diagnosed with breast cancer to ensure that you're getting the right treatment? So you're just a consumer. Do you advise people to get second opinions, third opinions? How do you know that you're doing the right thing?
Well, of course I advise people to get a second opinion, but I also think that communication with your doctor is crucial. Ask questions such as, are you following cancer treatment guidelines? The National Comprehensive Cancer Centers in this country had put a set of treatment guidelines for doctors to follow. I would ask my doctor, tell me what my options are and why. What do you think it would be best for me? Developing a partnership with your physician is crucial.
Right. Clinical trials, we saw in the story that you are trying to get your patients to maybe, if you can't help them, go to a clinical trial.
Absolutely.
Where can you get information about that? And how do you know that's a good thing for you if your doctor's not suggesting it to you?
I would go through certain websites, such as the National Cancer Institute, and look into what are the trials available for breast cancer patients.
Mm-hmm. But you advise patients to really please look into that.
Absolutely.
What kind of advice do you give to a patient who's just been diagnosed as far as how to communicate with not only their doctor but with their families and even with themselves? Like, how important is optimism in something like this? Do you feel like you play counselor sometimes?
Yes, absolutely. And hope for me has been my motto and my lemma, and I think that optimism is part of that hope, which sometimes is hope to be cured, sometimes is hope to live with this disease for a long time, sometimes is to be able to continue working, or even to die in
peace,
dignified and in a peaceful way. So to communicate with your doctors what your feelings are, what can you expect from this treatment. I usually like to incorporate the families because they play a very important role. Those are the ones that are with the patients when they leave their office. Those are the ones that deal with the everyday fear, and those are the ones that actually will support them. And they have their own sets of problems too that they need to be addressed. So having the family participate in the treatments decisions is very important.
Dr. Casimir, how do you know you're living smart?
When you smile every day after you get up, but when you eat correctly, when you are able to function every day, when you exercise.
So you just really live a healthy life, and that's what you're teaching.
Life.
That's what you're teaching your patients to do.
I tell my patients to live a full life, that the diagnosis of cancer, as it becomes a chronic illness, is something else that you put in your bag and you continue your journey. You don't ignore it, but you also don't stop living because you were diagnosed with cancer. You live with it.
What is the most satisfying part of your job?
Seeing my patients come back after 15 years without cancer, it's you can't explain it.
It's a joy.
Seeing the families when they bring their pictures of their kids graduating from college, when I get an invitations to somebody's children wedding.
It's part of life, the life cycle. Thank you so much, Dr. Casimir, for joining us. We really appreciate it. And for more information on Dr. Casimir, you can contact the Northwest Cancer Center at 281-440-5006. Another great website for information on breast cancer is breastcancer.org. Or you can call the American Cancer Society at 301-496-5583 or check their website, cancer.org. Please remember to visit houstonpbs.org/livingsmart for a complete resource list. And feel free to share your own tips on how to live with and overcome breast cancer. We'll post some of your emails on our website. Let us know what you think. Call us at 713-743-8513 or email livingsmart@houstonpbs.org. I'm Patricia Gras. That's our show for today. In our next episode, we'll talk to Senior Pastor at St. Luke's United Methodist Church, Dr. Jim Moore. He'll share how to cope with grief and loss. Thanks for tuning in, and remember to live smart. Have a great week. Yeah.